Ladies and gentlemen, please welcome to the stage tonight's host, Anthony Everett.
Hello, hello, hello. I know you're just coming in, but if I could ask everyone to find their seats and settle down, we do want to begin the program. We've got a busy and packed program for you tonight. We want to be sure we get everybody out of here on time, as well as get the opportunity for our speakers and awardees to have their moment. Welcome to Boston Healthcare for the Homeless program's 7th annual Medicine That Matters Gala. Tonight, we gather, as we do over these past 7 years, to recognize your generous support of this amazing program. It provides world-class health care to some of the neediest people in the city of Boston, our homeless men and women and children. And Dr. Jim O'Connell, who you're going to hear from later on tonight, and his colleagues have been providing that care for 31 years. Now, I know you're still finding your seats, but I do want to take a quick moment to thank some of our dignitaries that are in the room tonight. As you might see in the front of the room, we're very honored to have Governor Charlie Baker here tonight. Mayor Marty Walsh, Secretary of Health and Human Services, Mary Lou Sutters, Undersecretary of Health Alice Moore, Commissioner of Public Health and former Chief Medical Officer at BHCHP, Dr. Monica Burrell is here as well. Chief of Staff Steve Kadish, Chief Legal Counsel Lon Povich, House Chair of the Joint Committee on Healthcare Financing, Representative Jeff Sanchez, and Assistant Secretary for Mass Health and Medicaid Director for the Commonwealth, Dan Sy. And by the way, Dan Sy has been a long-time volunteer for BCHCP, and I have to tell you that he's been providing free haircuts to the clients at McGinnis House. I didn't know he had this skill, but apparently, if you're looking for a haircut, Dan is the man to see. We also have one absent dignitary tonight, Mary Richardson, who has hosted this event for the last 7 years and was going to co-host with me tonight, fell ill over the weekend, and she sends her regrets. It is literally the first event Mary has ever missed in her long career as a broadcaster and as an advocate in this community. So she's very sorry not to be here, but she sends along her best wishes. Last year, for those of you who were here, you may remember you hearing about Dr. Jim O'Connell's book, in which he chronicles the decades of the good work that he's been doing on the streets of Boston. Stories from the Shadows, Reflections of a Street Doctor, was just going to print at this time last year. And I can tell you that since that time, it has received national acclaim, and Jim has drawn standing room-only crowds to all of his readings. It's a remarkable book. It's a remarkable chronicle, if you will, of what he has done over the years. And those really are the stories that keep the staff, I think, keep all of us going and keep us giving as well. And that's, I think, a large part of why many of you are here in this room tonight as well, to give to this really, really special and wonderful organization. I'd like to thank the presenting sponsors of tonight's event, Bank of America, Conference Direct, and Liberty Mutual, and a special thanks to the Dignity and Respect sponsors as well, an anonymous donor, CVS, Medtronic, Natixis, Global Asset Management, and Gene C. Tempel. We've got a great program for you tonight, and now it's my pleasure to introduce this year's Medicine That Matters Gala co-chairs, both of whom very much long-standing and very generous supporters of BHCHP. Please welcome Anne Finucane, Vice Chairman of Bank of America, and John Heiler, President and CEO of Natixis Global Access Management.
Thanks, Anthony, and good evening, everyone. It's great to be here. Thanks for joining us here tonight. So I'll speak first, and then I'll leave John with nothing to say. But thank you to our honorary co-chairs, Senator Markey, Mayor Marty Walsh, who you may have seen earlier here tonight, Jack and Eileen Connors, and Jean Tempel, who I did see, so thank you. And then, of course, thank you very much to John Heiler, my co-chair, and for his leadership, and for the people of Natixis for all they've done here tonight. Tonight, we celebrate David Long and Liberty Mutual with the Tim Russert Award, established for those who raise public consciousness on issues of health and homelessness, for David's leadership and Liberty Mutual's long-term partnership with the Boston Healthcare for the Homeless. And we celebrate Governor Baker with the Jim O'Connell Award. Governor Baker's commitment to the Boston Healthcare for the Homeless program has been incredible, and it's also been there for a very long time. He has shown through his leadership a really practical approach to making sure patients receive the best in healthcare possible. He demonstrated it years ago as the Secretary of Health and Human Services, and he continues it today in all sorts of ways, including the bipartisan legislation to combat opioid addiction. So more on that later tonight. And then we celebrate all of you, a room full of believers who have raised $600,000 so far, and I say so far tonight, because we'll be increasing that number with tonight's auction and your generosity. So remember your generosity as the evening goes on. Please drink up. Bank of America has been supporting Boston Healthcare for the Homeless for a long time too, because like all of you here tonight, we are inspired, truly inspired, and we appreciate the center's dedication and expertise in delivering quality health care with dignity while creating a relationship with their patients and guests. And so just a few minutes on that word relationship, just if you could bear with me for a minute. 8 years ago, just before the center's doors opened for business, Tim Russert came to speak at that year's dinner held at Rose Wharf. And you will hear shortly his speech and how it formed the basis for the Tim Russert Award. But for me, it was a little different. Jack and Susie Welch were chairing the dinner that year and madly fundraising on behalf of the Boston Healthcare for the Homeless to assure that the new facility had success. So Tim had come to that evening at their request. They, in turn, had come to learn about and dedicate themselves to raising money for Jim O'Connell and his great staff's mission, having been introduced to Jim and the mission of Boston Healthcare for the Homeless by Dr. Carrie Akins. Now, Dr. Carrie Akins is a world-renowned heart surgeon who has saved tens of thousands of lives, including Jack's life. And Jack was determined to thank Carrie in some very meaningful way. And all the people that I just mentioned were my husband, Mike Barnacles, and my friends. And as it happens, Carrie Akins also operated on Mike and saved his life. And Tim is godfather, or was godfather, to our son, Tim, and our families were a close-knit group. And before all of that, Jim O'Connell had introduced Mike to so many people who made a difference in both their lives. Jim as a physician and Mike as a columnist for the Boston Globe. And along the way, Mike introduced me to Jim, so that's a very long way of telling you tonight is personal. Impressively, Jim has continued his work for decades, gathering such an impressive team around him: Barry Bach, Jess Gaida, Linda O'Connor, and the 300 dedicated people on their team, all who every day go to support the quality of life for those amongst us who could use the most help. And it's hard to imagine, I mean, for any of us, it's really hard to imagine how he and they find the energy and the inspiration every single day. But perhaps we can get some insight into, if you've read Jim's book, The Stories from the Shadows, at the end there's an epilogue, and I won't read the epilogue, but I am going to read just 2 lines from it, because he explains how we got here. In the beginning, I naively planned to devote a year to working with homeless persons and then pursue a career in clinical oncology. And then he goes on after a bit. As I slowly came to understand the importance of continuity, consistency, and presence in the care of homeless persons, my dreams of oncology dissipated. And then he began his lifelong commitment to medicine that matters. Thanks for being here. John?
So, Ann, I need to tell you I'm from a family of 10, so what you'll learn really quickly is if you don't have anything to say, you just say it louder. So basically, you want it up a little higher? Okay. You know, one of the things, Ann, and I'll start off right now, the things that you've done for the city and the Bank of America, and you've done it over the years, has been really remarkable. And this is an example of what you can accomplish. So it's been great being a co-chair, but seriously, kudos. Really appreciate it. So I guess I'll start off with, it would be nice if we lived in a world where the more virtuous your work, the less you had to ask for help. But we all know that's not a reality that we face, especially in our world. So the patients who pass through Boston Healthcare for the Homeless don't often overcome their circumstances to achieve fame and fortune. Their stories don't often make the evening news. They don't often become role models, even though many of them should be. But they are provided something much more precious than any of that, and that's dignity, by being treated with modern and very personal, compassionate health care. They're human beings who, through a period of bad luck, unfortunate circumstances, substance abuse or use disorders, mental health issues, have ended up on the street. Their life expectancy is among the lowest in society. Their rate of chronic illness is among the highest. And they deserve to be treated with respect and with care. Healthcare is not just a basic need. It's a fundamental right that we all deserve. At Natixis, we first came to appreciate the crucial role of Boston Healthcare for the Homeless in our community about 5 years ago. We've been believers ever since. We work with a lot of organizations that serve the homeless, and the more deeply involved we became with these groups, the more we found all of the benefit from the work of this amazing group at Healthcare for the Homeless. And the tie-in in the community that exists between these different organizations is truly what makes Boston special. Think about it. When you're down, it's hard enough to get your life together, or keep your family together, or get back on your feet. When you're also suffering from a serious mental or physical health problems or addiction, it can seem impossible. But with Boston Healthcare for the Homeless, it's not just what they do, it's how they do it. They dedicate their lives to helping people in need. They treat every person with dignity and respect. They give people the care that every human being deserves. And they've been doing it for over 30 years. We're fortunate to have with us tonight some of their greatest champions. I want to especially thank Senator Ed Markey and Mayor Marty Walsh for everything they do for our community. Their leadership has been so important on so many issues. We're really lucky to have them, because everything they do is personal. They live it right here in their hearts. Their sincerity, their passion, give us push to be more open to our hearts as well to help. I also want to congratulate David Long and Liberty Mutual for earning the Tim Russert Award. It's a phenomenal example of a great company that does some great things in our community. We're really fortunate to have companies like Liberty Mutual with leaders like David, and we appreciate all that you do. And finally, I want to congratulate Governor Charlie Baker, whom we honor tonight with the Dr. Jim O'Connell Award. I'm lucky to have known both of these leaders over the years. Dr. O'Connell is a great man who combines boundless compassion and great vision, and who forever changes community for the better. Charlie Baker is being honored not just because he's governor, but because he recognized the great work of Dr. O'Connell and his team many years ago, and has been doing everything he can to support them ever since. It's amazing that two people from different backgrounds came together so many years ago to accomplish so much to pave the way to help for no other reason than it was the right thing to do. I'm truly honored and humbled to know them both. Well, it's been a true pleasure to co-chair the gala with Ann. As you've heard, and Bank of America have been champions of Boston healthcare for the homeless for over a decade, and I applaud them for what you do and the organization does for the community. Like these leaders, we would love for you to invest in Boston healthcare for the homeless. We need the help. The project is something that will give more services, better services, and make what Dr. Jim and the whole team at Boston Healthcare and the homeless sustainable for many years to come. Make no mistake about it, it's an investment. It's an investment in this organization, in our community, in the city of Boston, and in our state. At Natixis, we make our living in investing. And when we make an investment, we want to meet the management team, see the operations, make sure things are running well. But most importantly, we want to understand the culture. So when I went to take the tour of Albany Street facility, I was really moved and touched, but also amazed at the modern facility, the technology that's there, the services, like any other fine medical institution in the world. That's what they've created. It's truly remarkable. So their services range from mental health to dentistry, and that's just one of the more than 60 locations. But you know what? Nothing I can say on the stage tonight can convey to you the size and scale, the scope of the organization. You need to see it with your own eyes like I did. And the wonderful staff and volunteers at Boston Healthcare for the Homeless would love to show you. They know that if you go, you will become a believer, like we are. Like me, like Ann, like anyone who has come to know this organization. You understand the why, you understand the culture. You understand all this because it touches your heart, but it also enlightens your brain. This is modern medical. This is modern medicine. That's the brain. And giving the best in medical services available to those who need it most is the heart. It's an argument you can't beat when it has both your brain and heart involved. So after dinner, you'll receive a cookie bag with a ticket attached. Don't eat the ticket, eat the cookies. This is also an invitation on the back of the program. Both of them invite you to take a tour of the facility. I urge you to give generously tonight because it matters. And knowing that your support helps the people that need it most should give you reason enough. But when you hear the speakers and see the awards tonight and you get to meet the staff, you'll even know it's an amazing institution with amazing people that do some amazing work. If you're as impressed as I was, maybe you'll even consider being a co-chair on the dinner committee next year. I always have to ask yes. I know Ann wants to do it again. She already told me that. No, I'm just kidding, Ann. I apologize. But now it's my pleasure to welcome one of the great people, Boston Healthcare for the Homeless, the CEO of Boston Healthcare for the Homeless program, Barry Bach. Barry.
Good evening. Really? Monica, come on. Dr. Slavin, I couldn't hear you. All right. So first of all, thank you all for being here tonight. And Ann and John, thank you so much for your remarks. And thank you for coming to the tour and seeing our facility. I also want to congratulate David and Governor Baker on their being recipients tonight of the awards. Liberty Mutual is just an amazing organization, has supported us for many years. As you all know, it's impossible to say enough to the governor about his work. Not only we knew him when he was Charlie and was in state government, and the work that he did on our behalf, and then just the amazing work around addiction services in the past year. And so we can't express our gratitude enough. I also want to thank Linda Wood O'Connor. Linda, where are you? Thank you. Linda and her team put this on. It's a fairly small staff, as many of you know, and just remarkable. And so thank you, Linda, for your great work. And then the gala committee and Maureen Heiler was instrumental in making that happen. And Maureen came for a tour recently. So thank you as well, Maureen. And if you can bear with me, I want to thank our Consumer Advisory Board. We have many members who are here tonight, and when I say consumers, they're patients of our services. Many of the Consumer Advisory Board members, we've had one now for 22 years. Many of our Consumer Advisory Board members are also on our Board of Directors, so I want to say thank you to them. And I'd also like to thank our Board of Directors. It's just a remarkable group of people who have supported us in so many ways, and a special shout out to our Board Chair, Brett Painshaw. So if you could, please. Poor Brett has to get these phone calls from me, you know, so we now just text, and he's like, yeah, please don't call. So, and then in recent years, and we've had sort of fits and starts with it, but it's really taken off in the past year or so. Special help from Scott Cronin, who's our newest board member, but this group of emerging leaders. I'm supposed to click something. I'm not seeing what I'm supposed to click. Sorry, Alyssa. All right. Oh, cool. All right. Thank you. Thank you, Governor. The governor's holding my cue card, so I appreciate that. It's really helpful. And actually, if I could ask the emerging leaders to stand. Where are you guys? Oh, cool. Okay. So it's a group that's coming together and bringing really a lot of new ideas to our program, new philanthropic initiatives to our program. And as Linda has told me, I'm not allowed to attend their events because they have age-appropriate gala. So we're supposed to put up the age-appropriate gala. And I'm like, I'm the CEO. And she said, yeah, it doesn't matter. Okay. So I'm really proud to be in the role that I'm in. I'm proud to be before you tonight as CEO of Healthcare for the Homeless. I've been there for 26 years, and I'm in love with the program. I've been in love with the program from the day I started, and that's not changed, and if anything, that's grown over the years. And, you know, we care for over 11,000 people a year in over 50 different sites. So as you heard about Jim, Jim's care that he provides, Jesse, our CMO, the care that they provide literally on the streets of Boston. And then we're providing care with many of our partners who are in the room today over at St. Francis House and Pine Street Inn, as well as over at our 780 Albany Street site, along with a number of family shelters and in many of the motels where a number of homeless families are. And we're primarily primary care providers and also providing addiction services as well as mental health services. I'm very proud of Billy Starks, the director of our behavioral health team. Billy in the past year created this open access model of mental health, and 1,000 additional patients were served last year as a result of Billy's ingenuity in providing those services. I also want to just share with you, we have a very large HIV practice, a very large practice for people with hepatitis C, and our quality metrics, so the quality outcomes, the lives that we've saved, are equal to best practices in the United States. It's just an amazing staff, amazing group of patients that we get to serve. We're looking to do a lot of new innovative care for women that we serve. Jesse is leading that charge as our Chief Medical Officer, and And then the final thing Jesse told me to make sure I hit this point is at the McGinnis House, over the past several years especially, we've been learning to do a lot more end-of-life care. So McGinnis House, our 104-bed respite facility, and we've done phenomenal care there for over 30 years now. That's the thing that the governor really helped us with tremendously many years ago. And now it's just routine for us to do end-of-life care. Special thanks to Dave Munson and Cheryl Kane for that great work. And we couldn't do this work without our partners, and we're really honored that Peter Slavin, the president of Mass General, I believe Kate Walsh is here, the president of BMC. Kate, are you here? I'm pretending Kate's here, so Kate's here. And I just want to share with you a couple new initiatives that are happening. So on June 6th, we're opening the Stacey Kirkpatrick House. And Stacey Kirkpatrick House is a 20-bed respite facility. It's very similar to the McGinnis House. It's a step down. And it's going to be in Jamaica Plain at the old site of our old McGinnis House. And I think it's important to share with you, Stacey was just kind of a beloved colleague a real friend to many of us. Stacy passed away in March. Worked with us for about 18 years as a nurse practitioner, was part of our senior staff. Just a remarkable woman, someone who really brought people together. We weren't originally going to call it the Stacy Kirkpatrick House. I just want to share this story with you briefly. We're actually going to name it after one of our board members, Jean Tempel. And Jean was a benefactor, someone who graciously supported our efforts. Jean was also a champion of this emotionally. And then when Jean learned of Stacy's death, she asked that we change the name to the Stacy Kirkpatrick House. So Jean, special thank you to you tonight for that wonderful honor. By the way, that's me in the shades, and I think that if I knew that this was going to be shown tonight, I probably wouldn't have worn those, but, you know. Monica, you look good, so. And then I just want to share with you one final story. It's not going to sound like an uplifting story, but it's kind of a trip. So about 2 months ago, there were, and Lindia, Karen, and many of you in the audience will know this story, we have 5 cases of what's called meningococcal disease. Now, the way you may have heard about meningococcal disease over the years is meningococcal disease for many people leads to meningitis. And you hear about it sort of in college campuses. Every so often you hear about 1 or 2 cases. We had a clustering of 5 cases in a 7-week period. Unheard of in Massachusetts at any kind of clustering, and certainly unheard of nationally in the homeless community. Our staff pulled together. We coordinated with our community colleagues, not only with all the shelters where we were on the phone and meeting in person 2 to 3 times a week, but we were coordinating with the city's public health department, with Monica and her staff at DPH, as well as, in fact, the Center for Disease Control that spent 3 weeks with us. We mobilized literally dozens of nurses and clinicians and sent them all around. We had to identify who were the closest contacts. It's amazing our shelter partners were able to identify who was sleeping next to whom. And then we had to treat all those people prophylactically. And then we did an immunization campaign. We treated over 300 people with antibiotics, did an immunization campaign where we gave immunizations to 3,600 people in a 6-week period of time at a cost of $75,000 to do this entire mobilization. And we couldn't have done that without you. And that's the reason I want to share this story with you, is that our ability to respond to the crises in the community and the needs of our community is because of you all. And so I want to just say thank you to the corporations, the philanthropic community, to our friends at the state and the city. It's just amazing the work that we get to do, and we're just so grateful. So thank you all.
Thank you, Barry. Thank you, Ann and John as well. I'd like to just reiterate what John said. If you have not had an opportunity to go and see the program up close, I highly encourage you to do that. If you look up at the ceiling here, you'll see some of the faces of the patients and clients that avail themselves of the services of this remarkable program. And I will tell you that if you go there, you will come out changed. You will come out amazed at the work that is done and changed forever by the service, by the love that is in this building. I highly encourage you to do it. I've done it. I've taken friends there. We've gone there. We've had the opportunity to go there with Chronicle. I highly recommend that if you've not been there, that you go there personally up front and see this up close. It is just remarkable work. As you heard earlier, the first award tonight is named for a man who came to know BHCHP shortly before his untimely death in 2008. He was actually here speaking at our annual dinner when Tim Russert was so moved by what he saw, and he so moved the audience in turn with his words and his call to help those in need, so eloquent as he was. So much so that the program has dedicated this award, as you heard before, in his honor. Annually, this award is given to an individual, a team, or an organization that helps to raise public awareness on issues of health and homelessness. Actually, tonight we do have a past recipient in the room. John Heiler, who's here and spoke before, is one of the past recipients. And to give you an idea of what an incredible man Tim Russert was, if you don't remember, here are his moving remarks at that event 8 years ago.
You're going to be all right. We're going to respect you. We're going to give you your dignity. But we're going to offer you a place of comfort, of healing. You're taking a morgue, a place for the dead, and bringing it to life, and bringing in these children of God and saying, we want you. You are somebody. Think about that. It is such an affirmation. Your faith, your strength, your love just radiates from this room. And it is such an example and a model to be imitated all across the country. It's not liberal or conservative. It's not Democrat or Republican. It's human and deeply spiritual and all-encompassing. And it is such an honor to be part of this. I told Susie in that book, the best commencement speech I had ever heard was all of 15 words. That indeed the best exercise for the human heart is reaching down and picking someone else up. And that's what you've done tonight. Don't stop. Let Boston be the model, show the way, so that all this country, with all our political disagreements and all our acrimony, and sometimes hostile negative ads, and sometimes a political dialogue that makes us all crazy, understand that when people come together and find a common purpose, a common good, they are unstoppable. Thank you, and God bless.
We miss Tim's voice, but we certainly share his passion. And to present the award, a longtime friend and a supporter of BHCHP, Dr. Peter Slavin, President of Massachusetts General Hospital. Peter.
Good evening, everyone. It's really an honor for me to be here tonight, not only to celebrate great work of Boston Healthcare for the Homeless, but to play a role in giving the Tim Russert Award to David Long and Liberty Mutual. We at MGH are very proud of our 30-year relationship with Boston Healthcare for the Homeless. We've been there from the very beginning. Jim O'Connell was a resident at Mass General, graduated from the program 2 years ahead of me. We refer to him as St. Jim, and we try to take a small amount of credit for the great physician and leader, an incredible set of values that he brings to this community every day. We were proud in 1985 to become the first private academic medical center to partner with the Healthcare for the Homeless program, and I'm proud to say that that partnership is even stronger today than it was 30 years ago. 5 days a week at MGH, we operate an outpatient clinic that sees patients from Boston Healthcare for the Homeless, and several of our departments, including urology, neurology, and dermatology, see patients at Barbara McGinnis House on a regular basis. So we are honored and proud to partner with this organization to provide care every day to our city's most vulnerable residents. I am equally proud and pleased to be here tonight to honor David Long and Liberty Mutual and thank them for their incredible leadership and generosity. It is truly fitting that this year's award go to David and Liberty Mutual, and as Tim Russert said, and as David and this company believe, the best exercise for the human heart is reaching down and picking somebody up. David has clearly emerged as one of the most important and capable business leaders in our community, but the skill with which he makes Liberty Mutual so successful is very impressive, but no more so than the skill and passion with which he tries to make people's lives in our community better. I have personally seen this in action with David Long's hands-on involvement and support of a program at MGH called Aspire, a program that helps children, adults, and adolescents with autism spectrum disorder and helps them make social connections and lead more successful and fulfilling lives. Along with his wife Stephanie and his colleague Tim Sweeney, he has built the most successful annual fundraising event at Mass General Hospital, which has enabled Aspire to expand its range of services and also to make its services available to kids from all walks of life. In addition, David has been a dedicated member of our President's Council, and I'm pleased to say is the newest member of our Board of Trustees. We at the MGH are just so fortunate to have him as an integral part of our family and to benefit from his keen intellect and brilliant leadership skills. But it is truly gratifying to know that David and Liberty Mutual care so deeply for those in our community who are experiencing homelessness. As you will see shortly in the video, Liberty Mutual has been a stalwart supporter and true friend of Boston Healthcare from the Homeless from its earliest days, and I'll let the video explain that relationship. In a recent Liberty Mutual annual report, David is quoted as saying, "Our giving helps to define us. Through Liberty Mutual Insurance's philanthropy, we fund nonprofits that are changing the lives of some of our most vulnerable neighbors. Multiply these enriched lives countless times over, and we begin to fathom the impact of our giving." His commitment to corporate social responsibility is real, and the philanthropy at Liberty Mutual is wide and deep. In 2015, Liberty Mutual was ranked as the #1 corporate charitable contributor by the Boston Business Journal for the second year in a row, and its employees contributed nearly $50 million to charitable organizations around the world. A remarkable 72% of employees contributed to 7,500 charities, and more than 26,000 employees served on 2,400 projects at 900 charities in 20 countries around the world. Regarding these inspiring statistics, David's response is, and I quote, "I remain convinced that it is this kind of goodness that makes this company great." And I would say that this is corporate social responsibility at its very best. Liberty Mutual is ranked 78th on the Fortune 100 list of largest corporations in the United States. We are so fortunate to have it based here in Boston and to have it led by David Long. And so please turn your attention to the screen as we pay tribute to this year's winner of the Tim Russert Award, David Long and Liberty Mutual. Thank you.
The number of Bostonians who experience homelessness during a year is somewhere around 20 or 25,000 people. It has been a very difficult, complex, persistent problem that involves so many walks of life. Our respite program, which is now called the Barbara McGinnis House, is 104 beds now of really intense medical, nursing, mental health care that provides 24 hours a day for folks who need a place to recover or a place to be cared for acutely or subacutely. The mayor said we could have this building for $1 a year, but we had to renovate it. And we didn't know at first how difficult that was going to be, but it turned out, the whole renovation, everything was over $40 million. And we had never tried to raise money before. And one of the very first companies that actually gave us $500,000 was Liberty Mutual. It took a big risk with us, and that, along with a couple of other things, became the seed for us to be able to actually get the entire $42 million over the next couple of years to be able to renovate and move into this building. Liberty Mutual gave us money to have a thing called the Life Essentials Fund. It's the ability for us to be able to buy a T-Pass for someone so they can get to a specialty care. For someone who can't read because they can't afford $75 for their glasses, we can buy the glasses for them. Our ability now to be able to have a Life Essentials Fund to provide those things has radically changed our lives. More recently, we have been developing a relationship with Bridge Over Troubled Waters. Bridge Over Troubled Waters really does an amazing job with adolescents, and as they become older, then often we will take over the care. And we realized that the continuity was really something we wanted to improve. And when Liberty Mutual offered us a grant, it was an opportunity to really sit down with each other and figure out how would that continuity work best.
Through Liberty's help, we were able to begin this partnership with Healthcare for the Homeless because they took on the initiative to really provide care to homeless youth and make sure that their needs are being met.
With help from Liberty, we've really been able to deepen that relationship. To have the consistency of Healthcare for the Homeless to be here each week, to have it be the same providers, and to have providers that really have a firm understanding of the needs of homeless young people has really been instrumental. With the closing of the bridge in Long Island, you had literally hundreds of beds, shelter beds that were lost.
When Long Island shelter closed, we had 4 hours to evacuate those people. And one of the first to respond to that was Liberty Mutual, who came to us and offered us money to help take our clinicians who had been out on the island and be able to reset up. And we had to rapidly deploy people to different places. And it was at a time of intense crisis in the homeless community. Liberty Mutual is the quintessential symbol of how corporate responsibility can really have an effect on the care of excluded and poor populations.
Ladies and gentlemen, please welcome to the stage David Long.
So good evening, and thank you for that very moving video and extraordinarily kind introduction. So Dr. Slavin, your presence here tonight and your presentation of this award has made this evening extra special for my colleagues and for me. And I thank you. We're so very fortunate to have your leadership in this city and to have Mass General and Boston Medical Center partnering with Boston Healthcare for the Homeless to bring world-class care to our most vulnerable neighbors. I'd also like to take a moment to thank our co-chairs, Anne Finucane and John Heiler. We know how busy you are, so please know that your leadership tonight is very much appreciated. And on behalf of all of my colleagues at Liberty Mutual, I am deeply honored and humbled to accept the 2016 Tim Russert Award. As only a true journalist can, Tim captured the essence of this great organization. He witnessed and spoke of the faith, the strength, and the love that he saw radiating around your building. A great reporter, he saw beyond the story of a new building to a new way of building people up with the dignity and respect they inherently deserve. It is a special honor for us to accept an award in his name. And this evening's made even more significant because we're sharing it with the governor. So Governor Baker, your leadership in this state has been bold and admirable, and how you've approached the opioid epidemic is no different. So thank you for creating a compassion-based policy and for using your platform to reframe this discussion. That is leadership at its best. And to our friends at the Boston Healthcare for the Homeless program, I hope you know how meaningful this is and such a distinct honor to us at Liberty. We are deeply grateful. However, our gratitude to you goes far beyond this event and this evening. We thank you on behalf of each of the 12,000 individuals you serve in this city, the underrepresented, the underserved, and the invisible, who will be cared for and championed and lifted up. We thank you for helping people who have nothing tangible in this world. And we thank you for meeting people where they are, under bridges, in corridors, in bathrooms, and in doorways, and for serving them as they are, with their trauma, abuse, psychosis, addiction, and much, much more. You epitomize and have institutionalized the goodness of the human spirit to heal, to honor, and to bring hope. So we at Liberty dedicate this award to the brave men, women, and children who are surviving on the streets tonight, who have lost almost everything, but who, with the help of Boston Healthcare for the Homeless, will find compassion, courage, and profound care before the morning comes. Thank you.
Thank you, Sure.
Thank you so much, David, for Liberty Mutual's longtime leadership and support of BHCHP over the years. It's tremendous, and probably couldn't be where we are without your support in Liberty Mutuals. We've got a great second half of the program coming up, including the awarding of the Jim O'Connell Award, and our favorite comedian and auctioneer, Tony V, is going to be here as well. If you haven't seen this shtick before, very good stuff. If you're on social media, I got to say this, the hashtag is Medicine That Matters. If you're tweeting or on Facebook or anything else, we ask that you use that hashtag to let people know we're having a great night, and maybe they can contribute as well. Please look over the auction items in your books, and dinner will be served now, and we'll be back a little bit with the second half of our program. Thank you, everybody.
Ladies and gentlemen, please take your seats. Ladies and gentlemen, please welcome back to the stage, Anthony Everett.
I love this table over here. One-man rooting section. If everybody could just take your seats and I could grab your attention. I know everyone's enjoying a chance to mingle. I know for some of you who are still eating dinner, some of you dessert's being served. But you can watch while you eat because we have a little video for you now. Recently, Chronicle had the great opportunity to go and visit the fine folks at BHCHP. And even though several of us on the staff had actually been there before and had an opportunity personally to get engaged with their work, it was nice to have the time that Chronicle provides to see what a day in the life is like for the patients, for the caregivers, for everyone involved in this remarkable program. It was a 30-minute program on Chronicle, but we have a small, about 5-minute excerpt for you here, so please look at the screens if you would.
On a chilly winter morning, Dr. Jim O'Connell takes to Boston Common to treat one of his countless homeless patients.
Hey, good morning. You okay?
Twice a week, for 30 years, he's walked these streets, delivering medical care to the city's most vulnerable lost souls.
It's ever challenging. The rewards are huge. Most of the people we take care of are exquisitely appreciative of the fact we're there. They don't have many people in their lives. And trying to understand what that experience of illness and suffering when you've lost everything is pretty profound and pretty moving. If you need to get that taken care of.
Homeless vet Bryant Draycott has a nagging foot injury and a bladder infection necessitating he wear a urine bag. Bryant's lived on the streets for years, and like so many homeless, he's come to rely on this humble physician they call Dr. Jim.
I've known that guy long enough to know my own family. He's better than a Boy Scout, for crying out loud. There is nowhere he won't go, and nothing he won't do.
Seeing patients on the streets is one of the myriad services offered by a remarkable organization Dr. Jim O'Connell co-founded in 1985. What began as a pilot program to treat the indigent has become a national model. Each year, Boston Healthcare for the Homeless sees 12,000 men, women, and children living on the fringes.
You can imagine someone who's homeless, who lives in the shelter, who has an infection in their foot, or even a simple surgery, and they can't go back to the shelter and recuperate there. Or they're living on the street and they have diabetes that's out of control. They can't really manage their diabetes on the street. So they can come in here and get those acute medical issues under control.
At Albany Street and Mass Ave, Boston Healthcare for the Homeless has built a state-of-the-art medical facility in a building once housing Boston's morgue. Here they offer comprehensive services, from a dental clinic to substance abuse treatment, psychiatric counseling to acute respite care.
Often when I'm initially relating to folks what I do for a living, they, their response is, oh, that sounds really sad, and it sounds like it's so hard. And I sort of respond as, I feel really lucky to work with an organization that is so robust and creative in the way that we're trying to deliver services.
We're underneath bridges, and we've taken care of people in corridors and in doorways as well as in bathrooms. I love our model. I mean, we literally meet patients where they're at.
The heroin epidemic has strained the resources of the healthcare system. For Richard Guido, Boston Healthcare's Suboxone Clinic has been a lifeline.
I'm 9 years clean. Being 9 years clean, having a place to live, and having a foundation. What this clinic has done for me is giving me moral support, mental support, social support. Everything that I needed, it's in this clinic.
It's a hard addiction to get away from.
Rafael Garcia slept outside on heating grates for years as he battled a ferocious heroin habit and HIV.
It's just an epidemic, and it's a disease. I mean, you're getting high, and your priority is to get that stuff that you use, the heroin, whatever. You'll spend everything you have on it.
With the help of Boston Healthcare for the Homeless, Garcia finally got clean last year. And he just found out this very morning he's been approved for housing.
I'm finally on my way to live on my own, have my own sweet home like they call it. Just don't have to be on the street anymore. And it's all due to getting clean and getting Suboxone.
The challenge treating the homeless is they present with so many issues, it's hard to know what to tackle first. Trauma, abuse, psychosis, addiction.
People who experience homelessness, particularly people who are experiencing long periods of homelessness, chronic homelessness, look 20 or even 25 years older than they are. A lot of the diseases that we would expect to see in a 60-year-old, we're seeing in people who are in their 40s.
My good people, you take such good care of me.
Some days here feel like Sisyphus pushing a rock uphill. But progress is measured in small miracles. Just ask Joanne Guarino, who survived violent assaults on the streets and severe leg burns in an incident that brought her here, desperate for help.
So when they took me in, they probably saved my leg, saved my life. I think I forgot how to love myself. I think I forgot how to care about myself in every which way possible. And I think they taught me how to really love myself for the first time in years.
I haven't had any of my other meds in a while.
What is O'Connell most proud of as Boston Healthcare for the Homeless celebrates its 30th anniversary? That during the winter of 2015, the worst winter ever, there were no deaths in Boston from hypothermia. That they've forged partnerships with Boston Medical Center and Mass General to treat the homeless. That they've built a full-time staff, nearly 300 doctors, nurses, and social workers who want to make this their life's work.
We have an extraordinary staff dedicated to taking care of this group, and they do it with you'd think it would be kind of grim to do it, but if you walk around, you'll see it's kind of joyful. People are offbeat, everybody's, working hard, but the drive to provide the best possible care for each homeless man, woman, and children we see is evident everywhere.
We were really honored to do that. And while Mary Richardson could not be here tonight, her husband, Stan Levin, is, and he actually produced that program. Stan, nicely done. And And actually next to him, we're very happy that Brian Menz, who edited that program, could be with us as well. So thank you for being here, Brian. And our president and general manager, Bill Fine, is here as well. I should mention that also. Thank you, Bill, for your support of all of our efforts. In Mary's absence, actually, Stan offered to wear her brand new dress and help out, and I said, ooh, no, I don't think that's maybe the best use of our time tonight. We do want to hear now from someone you heard in that piece, two people directly battling the opioid crisis, which, as we all know, and as the governor has made so many significant efforts to lead in this regard, has really affected our state and many states across the entire country. We'd like to introduce Dr. Jesse Gaeta, who is BHCHP's Chief Medical Officer, and Joanne Guarina. Dr. Gaeta has been instrumental in leading the organization's new program. It's an interesting program for substance use disorder treatment, while Ms. Guarino, a longtime patient, CAB member, and advocate for BHCHP, has been a peer supporter. Ladies.
Good evening, everyone. Thank you so much for being here. I want to talk a little bit about opiate use disorder from the vantage point of Boston Healthcare for the Homeless program. In 2013, a mortality study was conducted among 28,000 of our patients that we saw over a 5-year period, and it highlighted for the first time, in a way that made it abundantly clear that this crisis was at our doorstep, the astounding rate of overdose deaths among homeless individuals in Boston. It had now become and has been the most common cause of death among our patients. So this study really was very motivating for us. I remember looking at Barry and the two of us just having an aha moment that more important than ever, that the treatment of substance use disorder needs to be a core part of our program's identity. It was mobilizing for us, this study. We increased broadly across our program services for substance use disorder. With the help of so many of you in this room, we were able to quadruple our addictions programming, including access to life-saving medication like Suboxone, coupled with counseling. We were one of the first primary care practices to routinely and broadly prescribe nasal naloxone rescue kits. And we also looked very critically internally at our own prescribing patterns of opiates, and have decreased since that study came out the amount of opiates that we prescribe, and I think appropriately, by 50%. Despite all of those interventions and so many more by our city and our state, overdoses have continued to increase across the population of people that we serve. And the state's response has been nothing short of miraculous under the unprecedented leadership of Governor Baker, Secretary Sutters, Commissioner Burrell. From where I sit, I really couldn't be prouder to live in this state, the state that has the State Without Stigma campaign, a state with recent landmark, sweeping, and very creative legislation addressing all aspects of this crisis: prevention, intervention, treatment, recovery support. At Boston Healthcare for the Homeless program, we're making sure that we leave no Bostonian behind in our response to the crisis. People with substance use disorder who also lack housing have additional barriers to accessing treatment and to sustaining recovery. At the front lines of this crisis, we found that we really need to reach people who are the most vulnerable and who aren't able to, for any reason, access treatment at this time. And so really out of the desperation to keep people alive, we've decided that we're going to start there at that front line. We're going to engage, build relationship with people over time, and approach people, even those with the most severe and refractory disease, with no stigma and with no judgment. So in addition to working hard to decrease the demand for opiates, the supply of opiates, we are also working hard to decrease harm when people aren't able to access treatment yet. And this is the concept of our new program, which we call the SPOT. It stands for Supportive Place for Observation and Treatment. We opened about 3 weeks ago because of the support of a number of people in this room. And we provide medical monitoring for periods of time when people are in some continuum of overdose and are sedated. And it's been really pretty miraculous over the last 3 weeks to see the impact of this small program. I want to introduce to you Joanne Guarino, who is someone who is really helping us right there on the front lines. She's someone who has just given back to our patients and our program immensely, who has taught me more about this disease than just about anybody I know. She also happens to be one of our consumer advisory board members and even is my boss on our board of directors. She's about to receive a national award in Portland, Oregon for her work on our National Healthcare for the Homeless Council's CAB and Respite Care Providers Network.
Thank you, Jess.
Mm-hmm.
Does this come down? Yeah. Thank you, everybody. As you know, my name is Joanne. I just want to say that this program believed in me when I didn't believe in myself, and not by trying to hold me accountable for my insanity, but by offering help when the disease was at my worst, when I was at my worst with my disease. Now I'm in recovery for years. That's why I can kiss Charlie, wherever you are. And that's why I'm here, right, Charlie?
She had to tell me about that on the way up the podium.
But when I heard about this idea that they were trying to, open this SPOT program, I thought they were all nuts. And because when I was out there, we all went into detoxes, and that's just how it was. And I couldn't imagine I just couldn't imagine. And then all of a sudden, my brain, it's almost like a bell went off in my head. And I said, jeepers, even if we had detoxes, we can't put dead people in detoxes. Because what was happening out there was people were dropping dead, and we couldn't save them because they were dying out there, and that's what's been going on out there. So eventually, so now I'm involved in providing peer support at the SPOT program. He takes a lot of pictures, and so I know. I'm sorry. The hope right now is working with short-term goals. So we're trying to keep them alive one day at a time. That's my plan anyway. And my long-term goal, hopefully, is that one day these people will be productive citizens one day. So what I do is I sit around and I chat with them. And I can make people laugh sometimes. And I chat with them, and I try to get people to find their way out of the hell that they're in, you know what I mean? Because they are in a hell. And I know I'm not supposed to talk much because Linda will yell at me, and I don't want to get yelled at tonight. So I know that, I hope that you understand that the SPOT program, and I need to thank all of you, and because without you guys, I wouldn't be here. And you guys gave me my life today by the money that you donate in other people's lives. So that's important to me, and we need this SPOT to keep going because we need to save some more lives. But I think that's all I can say. What do you think? Thank you.
Wow. Not much more you can say after that, except now we'll take your money. And to help us do that is a longtime friend of BHCHP, a man who many of you know from years in comedy clubs all over Boston, all over the world for that matter. He's been here, I think, almost every year we've had this event, right, Tony? And you know Tony V, you know his voice, you know his face, you know his comedy. He's been in the movie The Town, State and Maine, The Heat, and many others. Going to give us a little comedy first, then going to help us with the auction. Ladies and gentlemen, Tony V.
Thank Thank you very much, Anthony. That was 2 Tonys passing in the night right there. That doesn't happen a lot. You get 2 Anthonys on stage and nobody's killed. They're just jokes. Everybody lighten up. It's nice to be among you again. I don't know what's wrong with this organization, but I have never been asked back anywhere this many times. I don't know if you can't find anybody else or you're not explaining it properly. But they go, will you do the thing again? And I go, yeah, sure. That'd be great. I had an incident. I have a lot of incidents. And by the way, please excuse my appearance, but this is what I look like. You play the cards you dealt. That's all I'm saying. And honestly, I don't expect much out of you. We'll try to get some money out of you later, which is why we're here. But here's the only thing I need you to know to have fun while I'm here. At no point during the evening will I pretend to have a heart attack. That's it. That's all I need you to know right there. So it follows, if for some reason I fall, don't laugh for 10 seconds. Going, oh boy, is he committed to this little physical piece of humor? Nope, I'm checking out. Call somebody. And weird things happen to me. I had an earlier show at Giggles, which is a comedy club, that Route 1 southbound. Yeah, it's August, yeah. Not northbound, not the same feeling. Southbound's where all the action is up there. And I was coming down your fine Route 1, and did you ever get in that phantom traffic? I know we've been doing a lot of talking on the airwaves around here about traffic in Boston now, and it really has gotten ridiculous, has it not? I was driving today. Did you ever get in that traffic where you're driving and then you're not? And then you go a half a mile and you're going again. And there was nothing in the way. It just starts up. You're going, why was I not going back there? Look, I don't mind getting stuck in traffic as long as when I get to where the problem is, there's a problem. Honestly, I just want to see damage, that's all. I would like to see the jaws of life being used, that's all. Okay, yeah, major accident, we're fine. But today, this really happened today. I was coming down Route 1 to get here, and I had a small margin, and I got cut off by a boat. It was somebody with a boat just cut me off. And if I ever hit that boat, you'd have to explain that to somebody. You know, I could see me talking to the insurance company. Yeah, I hit a boat. Did you go off a bridge? No. I was on the highway. And you almost hit a boat. Yep. Rear end of the boat. What kind of boat? I don't know much about boats. But it's pretty powerful. It was pushing a truck. Weird stuff happens to me. I don't know if anybody has that life where just things happen that you don't know. I was checking my fire alarms because they tell you to do that. I would never do that unless I don't do a lot of things unless people tell me. You know, they go, check your fire alarms. I go, why? There's no fire. You know, it's like a leaky roof. You don't miss it until it's raining, you know. So we got the new smoke detectors. They're smoke and carbon monoxide together. Have you done that? Yeah, you should bump up. It's really great. And you test it, and this ear-piercing sound comes out. That's got dogs howling 4 blocks away. It's like a noise you can't imagine. And then right after the noise, a calm woman's voice comes on and goes, fire detected. Like the ear-piercing sound wasn't enough to get, you know what I think at least the voice should match the sound. You know, it should be a calm woman going, fire detected. It should be going, hey, get your butt off the couch. Your house is on fire. And I like my couch a lot. That's why I get in no trouble when I'm on my couch. All the trouble starts when I'm off my couch. You know, like my kids always want me to go out. I don't like out. I like in. I like to watch out on like a 64-inch plasma screen in high def. You know what I mean? If you open a window, it's almost like it's real. It's almost like being out there. My kids last year talked me into taking them to Niagara Falls. You ever been? Yeah, I had never been. I was sitting with my 17-year-old son, and he goes, Dad, you ever been to Niagara Falls? And I said, no, I have not. He said, neither have I. He said, I should hope not. I think I would have missed you for 4 or 5 days. Hey, where's that kid that doesn't come when I call him? Where's he at? And we drove up through upstate New York. You ever been there? Ooh, there are some ugly people up there. Not regular ugly either. I am not talking about us. Don't look around. Believe me, I know I'm no picnic, but I'm symmetrical. We were driving around upstate New York. I'm going, how the heck did that happen? Look at that. A whole family of you. They directed us to a family restaurant. And I don't know why I'd never been to Niagara Falls, by the way, except I don't like Canada. I'm not a fan. Nothing to do with the people. They were lovely. I've just never latched onto the Canadian culture, if there is any. And this is as simple as I can make it. In the history of eating out, this has never been said. What do you feel like eating tonight? Canadian. You've never been to a Canadian restaurant in your life. They got no food. Chinese, nope, Canadian. Italian, nope, Canadian. They got nothing. They got the bacon and the ginger ale. Canada Dry, help the others. We're doing great. No, we're all rowing in the right direction. We're doing fine. It's all to help the people. And we get up there to Niagara Falls, and this is the part I did not know because I had never been, and it's really lovely. But you can get right up to Niagara Falls. Did you know that? I thought there'd be like a plexiglass barrier or, the Mounties, chicken wire. Nothing, just water. And I'm standing there lost in my own thoughts, and the water goes by nice and calm, and it's very picturesque, and then it goes over the falls in this rush of energy and excitement, and I'm sort of lost in my own thoughts, and there's a little voice in the back of my head going, I think I could make it. And I'm looking at my wife, and she's looking at me. She's going, you're thinking of jumping, aren't you? And I said, yeah. She goes, good, I'm thinking of pushing you. I think you could make it. It'll work out good for everybody. And I tried. We ate at this family restaurant, I started to say, and I don't know what family it was. They were very close-knit. You can come to Giggles if you want to hear the rest of that joke. Like, the restaurant had a clown, but I don't think he belonged to the restaurant. I think it was just freelance clown wandering around upstate New York. This guy just wanders over to our table. Hi, I'm Grumbles the Clown. Can I do anything for you people? Well, you can step away from my 15-year-old daughter for starters there, Grumbles. What you and your balloon animals got up to after that's none of my business. It's all about health tonight, too, and I'm trying. People always go to me, hey, you look like you're losing weight. I go, I don't know. I don't pay attention. You know what I mean? I just eat. That's the guy in me. Guys don't want to know anything. We just want to eat and die. If we have sex in the middle once in a while, that's fine. And people go, you trying to lose weight? I go, well, I'm talking to you. I'm not eating. That's got to be pretty good, right? And I actually went on a diet once. In the first 2 weeks, I lost no weight at all. I actually lost height. I have no idea how I pulled that off. Apparently, I had about 1/4 inch of fat on the bottom of my feet. And I lost that and I shrunk. I don't know how anything works. I really don't. And no wonder why we're obsessed with it. I went into a Dunkin' Donuts recently just to browse. And I like to keep my place in line. If you don't go every once in a while, you get usurped. And that's a good word. Anyway, I go in, and I don't know if you've seen this or if you've been in a Dunkin' Donuts. They have an Oreo cookie shake. Yeah, you can get an Oreo cookie. Oreo cookies don't need help. They're cookies. They're the best thing in the world. Like somebody went into Dunkin' Donuts one day, I love the taste of Oreos. But all the chewing is so annoying. Is there any way I can get a cookie in me faster? Can we like blend it up and I can just suck it through a straw? Is that? Yeah, we'll fix you right up. You want us to throw a burger in there for you till you get your whole meal out of the way? And I do try. I have trouble in public like that. You know, we live in a very politically correct world, and I'm all for it. I'm a pretty easygoing guy that way, you know. But I found recently one of the hardest things to do in public is eat a donut. Nobody can leave you be anymore. They got to give you 20 minutes on how crappy they are for you, like you didn't know. I was at a coffee shop, and a woman, acquaintance, I barely knew, she goes, "Ah, you're still eating donuts?" I said, "Not all of them. I was going to have this one till you came along." And she says, "You know how bad those are for you?" And I went, "Yeah, pretty sure I do, yeah. Just a big fried hunk of dough, no way to slice that good." Then she actually had the nerve to say to me, she goes, "That donut's going to kill you." And I said, "I hope so. I hope right this second, I hope I drop dead right now. It would be better than talking to you." And then they get all flustered. And I do try. I went to my doctor recently because my wife made me, which is really the only way a guy will go to a doctor. You know, if his wife, guy, again, you know, okay. And she was so nice about it. She said, "You really have to go get checked out. I'm worried about you, and I don't want you going belly up, and I get stuck raising your demon spawn alone." And when someone says something sweet like that, so I go to my doctor, and he's checking me out, and he goes, "Tony, I think you're doing the best you can do." Which I don't know what he just said to me. You know, for a normal human being, not so good. You seem to be breathing. Let's start there. And then my doctor did the weirdest thing. He left in the middle of my exam. You ever have that happen? He just walked out. He goes, "I'll be back in a couple of minutes." I go, "Where you going? What's more important than me?" And they leave you sitting there all vulnerable in your underwear on crinkly paper. You ever been alone in your doctor's office? All you can do is try not to touch all the stuff in there you want to be touching. You're just sitting there going, "You know, I could use a gross of tongue depressors. If I had my own stethoscope, I could do this myself." And then my doctor comes back in the room. He goes, "Tony, I need you to pee in this cup." And I go, "From here?" "All right, it's your office. I'll give it a shot. I'm going to get a little on you. I don't know what kind of outfit you're on in here. You're going to need more crinkly paper, I'll tell you that." And then he says this to me. He goes, "You got a little high blood pressure." And I go, "Well, what do you do for that?" He goes, "Well, I got some pills I can prescribe to you." And I go, I don't really like to take pills that are prescribed to me. "What else you got?" He says, "Diet and exercise." And I say, "Let's go back to the pills." And then he said, "There could be complications. You should really take care of it." This is why doctors are great. They really are, Jim. They'll tell you like it is. He goes, "You could have complications." I go, "Like what?" He goes, "You could go blind." I go, I've seen enough. I'm 60 years old. What are you going to show me I haven't seen? He goes, "You could have a stroke." And I go, "I need the rest." And then he goes, just like this, he goes, "You could have trouble performing." And I go, whoa, 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 whoa. I couldn't be a stand-up comedian anymore? And he explained it to me. And I said, "Well, why didn't you start with that one? Conversation would have been over 10 minutes ago." And it's a good thing doctors exist, because I am not good like that. I had this happen to me, and this is real. You got to hang with me for this one. We were at a nice restaurant, steakhouse, for my wife's birthday, because she wanted to go, and I had a gift certificate. Oh, and when I got it, I throw it around. Your instinct is right. You won't hurt my feelings. They're all just jokes. And someone actually stood up in this restaurant and said, "Is there a doctor in here?" And I've never heard that before in my life. I thought that was just for cartoons. I didn't know it was real. And by the way, that phrase, "Is there a doctor in here?" screamed in a crowded room, Never followed by anything good. Nobody ever stands up and goes, is there a doctor in there? We found a bag with $15,000 that belongs to you. It's always, dude, you got to go to work, you know. And so there was a woman choking, and I was doing what I could do, which was to stare down at my food, ignore the whole situation, and continue to eat. And my wife of 24 years starts nudging me under the table. She goes, go do something. Go help. Me. Now, you've known me about 8.5 minutes, and you already know I'm not going to do anything. You'd think a woman I've known for 30 years would have picked up on that. What do I even, there's no situation where someone's joking and goes, oh my God, is there a comedian in here? What do I even do? You go over, can you hear me? 2 guys walk into a bar. No, sorry, that's all I got. I don't know. Heimlich's got his thing, that's mine. That's all I know. So you guys are very, any questions so far? I've been monopolizing the entire conversation. I will leave you. I'm not leaving you. I'm going to stay, and we got a couple of auction items that we're going to do, Anthony, right? 3 auction items, and then the fund to need. Anthony will explain that to you, how this works. And you guys are really nice for doing this all the time. And I will leave you with this. This is the best piece of advice I can give any group of humans. Never dance naked with an oscillating fan. Yeah, that's it. Yeah. Oh, and learn how to spell oscillating, in case you have to fill out the insurance forms. That's all I'll say. That's a pretty big thing. I did have one more. I'm going to do it, too, because you're nice people. My wife's got me watching a TV show called Naked and Afraid. Do you know this show? I didn't know anything about it. It's an actual show. It's called Naked and Afraid. And if you don't know what it's about, that's what it's about. It's on late Sunday nights, and I'm walking through the living room one night. My wife goes, you got to see this. I go, no, I don't. I sat down. I was watching for 3 or 4 hours. And I go, you're right, I got to see this. And that's what, they get 2 complete strangers, a man and a woman. They take all their clothes off them, right? And they give them like a Swiss Army knife and a canteen. And you got to survive in the wilderness for 21 days. And there's no prize. You win nothing. The prize is you're alive at the end of 21 days. And if you've ever seen the show, it's awful. They come to get them, and they're emaciated. They've lost 30 pounds. They're all bug-bitten, sunburnt. Their hair's all matted. They're filthy. They got fungus on them. It's awful. I ever did that show, you pull up 3 weeks in to get me, I would be sitting on a pile of bones all by myself. 40 pounds heavier. That's all I know. I'd be sitting there going, I have no idea what happened to that woman. I don't know. No, she left like 2 days in. It's your show. You should have kept tabs on her. All right, you took that one very well. All right. All right, Anthony, you want to come up and we'll kick this off? Thank you very much. You guys have been fantastic. As always, I look forward to this every year. Thank you, man.
Tony V.
Thank you.
The man. So, Tony, we did learn, Tony, you are not a doctor. Is that right?
I am not a doctor.
You are not a nurse.
I am not a nurse.
Okay,
I have nothing.
Very few of us can be doctors.
Or nurses.
Who do the good work that all these folks do.
Or astronauts.
Or many other things.
I asked that, too. They don't want me.
But you can help. You can help tonight, and on your table are these prescriptions for health cards, and there's all kinds of different levels of donation. If you would take a look at those, and in any amount that you can give, it will make a difference. We do have suggested amounts on there. If you feel generous and want to go above that, you're more than welcome to go above that as well.
Oh, we'll take anything. Right?
What's that?
We'll take anything.
We'll take anything. Any amount on those cards, and you can put them in the little red bag in the middle of the table.
Yeah, a lot of times at these things, people raise a paddle of their hands, and, we know. But this is just up to you. You put any amount you want. 100 grand. That buys socks for a week and a half.
And there's an added incentive, too. Anyone who fills one of those out, anyone who fills one of those out is going to be in a lottery for tickets to the Red Sox.
No.
That's right. From
Man,
the
they are
ENC
on
Club.
fire.
They are on fire.
They are on fire, the Red Sox.
That's
aren't
free
they?
parking and 4 tickets to the Red Sox. And
wow.
But wait, there's more.
Are you kidding?
I'm not kidding you.
Parking alone is worth $17,000. Don't even go to the game. Just park and go to dinner. Give the tickets away.
We've got some live auction items, too.
Yes, we do.
You're going to auction those
Yes.
off, right? All right, so
Yes.
you can talk about these, but briefly, there's a private dinner for 20 at the Beacon Hill Bistro's new balcony overlooking Charles
Oh,
Street.
they're great over there.
Very fancy,
Yeah,
very
fancy.
nice. There's
Yes.
also an exclusive tour of the State House with Governor Baker.
No.
Which is, I'm telling you, that's what we
The
have.
governor?
The governor's going to give you the private tour. And if you get to his desk and there's a couple of bills laying around, I think you can just
You
sign
sign
them.
them.
You just sign them.
Yeah. Bring your own pen.
Bring your own pen, sign them into law. It's a very exciting
Do you
part
provide
of the
the
tour,
pen?
actually.
Governor, do you
Governor
hey,
has the
he's
pen.
got- you get the governor's pen.
There's also a night at the Bank of America Fenway Suite. That's 22 people get to go see the game.
Wow.
At the Bank of America Suite at Fenway Park. And Red Sox legend Dennis Eckersley is going to come by for 3 innings and hang out, take photos, sign autographs, that sort of thing.
Great.
He might stay for more if he's not
Will
working.
he bring his interpreter with him?
I don't.
You ever listen to him after a game? You go, I think he said something good. He's got taters and everything. Go ahead.
But wait, there's more.
There's more!
Any gift, anything you give tonight through the Prescriptions for Health or through the auction, anything that you give is going to count twice because thanks to the generosity of a few of our board members who would like to remain anonymous, they're going to match anything that is given tonight from your table or in the auction items up to $100,000.
Are you kidding me?
I'm not kidding you.
Wow. Wait, there's a group of guys and they're going to do something and they don't want you to know who they are?
Yeah, that's what I heard.
All right, they're not politicians.
So, Tony, the live
Is he
auction
laughing? Is he laughing?
Got quiet.
I didn't mean you. You're not a regular politician. You're like a guy. I saw, listen, I have said this in public before. This guy, our governor is such a guy. I saw him at a Springsteen concert on the floor, dancing. We got a dancing governor. Yeah. Yeah.
Yeah.
Yeah. Yeah, you're not going to see Chris Christie doing that.
No, and you
Someone
don't
get
want
knocked
to.
out.
I don't
Yeah.
think you want to see that either. We also have a governor, as I learned last week, with the highest favorability rating in the entire country. Number one governor in the country. Very impressive.
You know what I say about our governor, and I'm not just saying it because he's here and he could tow my car or whatever they do. He's the kind of guy that our governor has grown on me like exponentially. Like when he got elected, I go, he seems like a pretty good guy. And I go, oh, he's a really good guy. And then he keeps going, I go, he's a pretty good governor too. And then I saw him at the Springsteen concert, I go, I want to hang out with him. That's the guy I want to be. He's great, so good. Thank you, Governor.
All right,
So here
you're
we
up
go.
for the auction.
Now we're going to do the auction.
We're going to do the auction.
All right, we're going to start with the Beacon Hill Bistro.
That's a great
And
one.
this is for 20 people. Dan right here runs the whole place, and he's going to throw in a suite at the Lenox Hotel. Correct, Dan? Correct. You'll get a suite dinner and drinks for 20 people on the beautiful balcony overlooking Charles Street. That's pretty nice, right? Prepared by award-winning executive chef Lucas Souza, known for creative menus and marrying contemporary and traditional French bistro cuisine, sourcing the best local ingredients and produce from New England's culinary bounty. I don't know what any of that means, but it sounds pretty sweet. He'll probably go down to the garden and get one of the ducklings. Well, they're made out of brass. I'm not saying the real one. Put on your table. You guys have a bad mind. I wrote a book, by the way. You know, they had that book, Make Way for Ducklings. I had a cookbook accompaniment called Make Ducklings My Way. Didn't do as well. I'm moving it. Oh, yeah. Okay. These are your... Now 408 can't bid. These are the things we need if you're bidding on an item, okay? These are your cards. You hold them up. proud and high. We have lovely people gonna get your number. So let's start this off. And all kidding aside, this is an amazing, one-of-a-kind, can't get it done. If you have a business or something like that, it's great. I've worked at the Lennox. I've eaten over there. It's great. Every restaurant is fantastic. And the Beacon Hill Bistro is on beautiful Charles Street, one way. You can parking and everything. So who's going to start me off at $1,000 for this? I have $1,000 in the back. Who's going to give me $2,000 now? $2,000? $2,000 I have. Now $3,000 will take this. It's for 20 people. Can't get it. Do I have my 3? I have 3 right there. 3, now 4. This side of the room. Anytime you want to jump in. Is that $3,000 to you, sir? $3,000. Was that 3? Yeah, 3. Now I need 4. 4,000. It's for 20 people with wine. You get wine, right? Liquor. You get liquor in the whole bar. Not even a glass. You can just grab a bottle. Grab a bottle and start chugging. That's all you can do. That's $5,000 to you, sir. Is that good for you? 5. Yeah, he's pretty happy about it. That guy wants to go eat at your place, and I don't blame him, Dan. That's $5,000. Now 6 will take it. 6? $6,000 I have. Now we're starting. 6,000. Anybody else? 7. 7 will take this. 7 is for 20 people with liquor, with wine. You get the whole deal. And, he's going to throw in a suite. Yes. So when you can't walk from eating anymore, they'll just roll you over to the Lennox. And you go right to bed. $6,000 to you, sir? You're a nice man. You want 7? It's 7. The governor's really paying attention. No, he's fiscally responsible. He knows. He knows. I trust that man. And if he says it's 7, it's 8 to you. That's what I know. I have $7,000 right here. 7,000 now 8. 7 now 8. 7. This is where we this is it. It's all going to the place. I know it's the health care for the homeless. I was just over there Friday. Can I just stop you? Sir, remember you're at $8,000. Anthony, if you don't try, you don't know. When you do film or TV or movies, even small roles and stuff, you get to know things. And after every time they shoot a scene in a movie, they take what they call the room tone, which means, Stan, you know about this, right? You take a room tone, because every area has its own feeling, its own sound, its own life. And when you walk into healthcare for the homeless, what you hear over there is hope and dignity. You know what I mean? You walk in there, and without anybody doing a thing, you just feel uplifted. You would think it would feel like, oh my God, these poor folks, but it feels like there's life in there, and that's what you're helping out tonight. So, $9,000 to you, sir. All right, it's a privilege to give, isn't it? No, you're at 7. I know that. 7 now. 8 will take this. 8. Anybody? 8,000. This goes. 8,000. 20 people. Liquor, wine, a suite. The sommelier won't leave your table. He'll just stand there with his ribbon on, going, "You want some more?" You go, "Yeah. What was that good stuff? Give us more of that. That'd be good." So I have 7,000 here. Now 8,000. 8,000. Anybody? 8,000. 8,000. 8,000. It's one more than 7. That's how an auction works. I say a number, you say one more. All right, $8,000 is pretty good. I'd love to get 9. I know it's 7. But they didn't know. Someone would have went 9 and I could have jumped 2. And then everyone would go, he's not as dumb as he pretends. All right, $7,000 I have. Can I get 8? Can I get 8? I'm looking for 8. 7,000. 7,000. We happy with that? It seems like you're happy with that. Yeah? Dan? No? Yeah? It's okay. I'd love to get 8. I would love to get 8. Anybody? 8? It's only one more. The zeros mean nothing. They're just nothing. Zeros. Nothing. Maybe I'll read it one more time, Anthony. I know dinner and drinks, liquor bar for everything. It's overlooking Charles Street, best street in the world. You get the prepared meal, locally sourced, so you feel good about that. And you will get a suite at the Lennox. All right there. You put up all 20 people?
Wow.
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 Wow. I don't know why I just took off my glasses like that, but that seemed like a moment I should do that. You know what I mean? I go, did you say 20? Wow. All right, so now they're going to put up 20 people. That's got to be worth another $1,000. Anybody? $8,000. There you go. See, I knew we could do it. I knew it. Sir, I really want you to get this. Yeah, I do. I really do, because you're so nice and you love the bistro. You walk by it every day going, oh, if only I could eat there with 19 of my friends. And then just fall down asleep in a coma from all the liquor and food that's locally sourced. The grapes that they make the wine out of come right out of the Harbor Islands. Grape Island. Grape, they squeeze them right there, right at your table. It's fresh. Fresh wine, stomped right at your table. They got a big bucket. Yeah, with the feet, yeah. You just look for the guy with the purple toes, and you go, that's the wine guy, I can tell. Yeah. 9,000? You're going to give 10, and that's it. All right. 10's pretty good. Yeah. Wow. 10? You do it? If I get another 10, you'd do that? You would? Now, Dan, I just said, it's Donahue, correct, Dan? Yeah, Dan Donahue runs the whole thing. He's the governor of the bistro and the Lennox. And he says if I can get another $10,000, he'd do it twice. He'd do it. Sir, thank you very much. I got another 10 grand right there. I don't know if he's playing games, but he just said he'd do it again if I could get another 10 grand. What's that? $1,000. Worth every nickel of it. So I have 2 of them. Anybody else? The guy was at 8. It's only 2 more. I'm sure you got a business. You can write it off. Do you have a business? You just got 10 grand floating around? Good, you reach for your card, do it. Yeah, there it is, right there. 10, thank you. That is $30,000. Thank you to the generosity of Dan and to these fine gentlemen. Thank you, and thank you. Yeah, thank you very much.
Did we mention everything gets matched? Everything gets matched.
That was $60,000. So that's $60,000 you just raised.
$60,000 right there.
$60,000. And it's not like you're not getting a deal. Dinner over there costs $12.50 anyway. Right? Lunch you get out for $800. Well, now listen to this. If you think eating over there is pretty good, you get Governor Charlie Baker. That's our governor. Sitting right there. You get a private tour of the State House and the governor's office. You join Governor Baker for a tour of the governor's office at the Massachusetts State House. He could give you a tour of Rhode Island State House. It's smaller. Wouldn't take as long. And then you visit the governor's ceremonial office and the governor's council chambers, and you get a photo opportunity with the governor. He'll take your picture. That's the kind of down-to-earth guy he is. You can take a selfie with the governor. No one else can say that. So I don't know what we would start this off, Anthony. That's a once-in-a-lifetime. Well, no, he'll be the governor for probably 50 or 60 years, I'm guessing.
With that popularity
so probably
rating.
a twice-in-a-lifetime thing. You know, so that's it. You get a private tour of the State House. He'll show you where all the, all the stuff we don't know about is. The aliens, where they hide them. Well, that's Area 51, right? Yeah, sorry. All right, I get carried away. But you'll get a private tour with the governor, and maybe he'll show you some of the moves that he used at the Springsteen concert. I'm telling you, he was shaking it. That's all I'm going to say. So who's going to start me off at $1,000 for a private tour of the State House with Governor Baker? And let me remind you, he's sitting right here. Right there. $1,000 you can... You throw in lunch? Can somebody throw in? $1,000 I have. Nice. 1,000 now 1,500. 1,500? 1,500 I have. 1,500 now 2,000. 2,000 I have. 2,500. 25 now 3. 25 3 right there. Will you autograph that picture for them, Governor? Of course. The governor says he'll autograph it for you. Not a lot of people can say that. This is my buddy Charlie. Who's that? That's the governor. He signed the picture for me. $3,000 I have. Now 35. 35? 35 I have. Now 4,000. 4,000. 4,000 I have. 45. Don't stare it down. Oh, do stare it down. Stare it down. I want to see that. I love a good spitting contest. He cleaned that up for the room. I have 45. 5,000 to you, ma'am. 5,000? 5,000. 5,000 I have. Anybody else want in on this? He doesn't do this a lot. He doesn't sign autographs a lot. He doesn't. Do you? Do you a fair amount? Yeah. But you'll do it legibly, right? You can bring as many people as you want. All of you. We're all going. We're going to get a bus. We're taking the whole room. No, I know. I exaggerate for comedy purposes sometimes. And other times people just stare at me. And they go, what's wrong with him? Does anyone, Anthony, you know how much money I have? $5,000 from this young lady right here. 5,000. Anybody want to go 6,000 for the governor? For the governor. $6,000, he'll drive you home. Take a tour, put the lights on, drive you right home. Right to your door. Most exclusive Uber driver you'll ever have. All right, $5,000 is good. 5,000. You know, 5,000. 5,000 going once. 5,000 going twice. Sold for $5,000. That's great.
Awesome.
Which as we know, is $10,000, right? So far we're up to 70 grand.
That's math.
See that? That's Somerville High for you right there. Well, 2 years of Matanon and then 2 years at Somerville High. Yeah. Matanon and I had we came to some arrangement. I didn't want to be there. They didn't want me there. It worked out pretty good. So, anyway. So here we go. This is our last item. It's the Bank of America suite at the Red Sox game at Fenway Park for 22 people. It's the Minnesota Twins game on Thursday, July 21st, middle of the summer. Nice. They're on fire right now. They're doing great, and there's no signs of them slowing down. You get food and beverages, including soda, beer, and wine, and 2 parking passes. And then there was a speed bump. Yeah, just get a big SUV and put 11 people in each. And then maybe you could park up at the State House while the governor's driving the other people home. He won't be in his spot. And you go, the governor said I could park here. We got to go to the game. So you get that. And then you get a surprise. Well, it's not much of a surprise if I tell you, but Dennis Eckersley will stop by for 3 innings to sign autographs and mingle and take pictures with your guests. All right, so that's 22 people. I have, on occasion, been invited to a suite, and it's like it's a whole different experience. You're away from the filth. You got your own private bathroom. The seats are spacious. You can go outside, you can go inside. They have a full buffet, and you get beer and soda and everything, and 2 parking spaces. Well, if you bid on it, you get to park, and then your friends will know who you like best. That's all. But you get 2 parking spaces. So who's going to start me off at, these routinely go for, 29, 30,000, something like that. And I'm going to start it off at a tenth. Who'll give me $3,000 for this? $3,000 for the suite at the Red Sox game on July 21st. $3,000 I have in the back. $3,000, now 4 will take this. $4,000 I have. $5,000 now. 5 in the back. Don't look at her. Don't look at, ma'am, don't look at him. Just raise your paddle. Thank you very much. That's $5,000. Sir, don't you squash her dreams. She wants to go with 22 people. And you could be one of them if you just knock it off. $5,000 I have. Now 6. 6,000 anybody. 6,000, 22 people, the suite. Dennis Eckersley will come by, pictures, autographs, the whole deal. $6,000 right over there, I see that. You have that number? Good. 6,000, now 7. 6,000, now 7. 6,000, now 7. Sometimes the Beacon Hill Bistro caters the boxes. I don't know if this is one of those times, but you should go and try to figure it out. You go, these chicken wings must have come from Charles Street. They have a fresh air of produce picked right here. $6,000 I have, now 7. 7,000 will take this. 7,000, 7,000. 6,000 I have. 6, now 7. 65, want to go 6,500? I'll go halvesies. I'll go halvesies. Think about that. Take your wedding party. I don't even know if you're getting married, but it'd be worth it. All right, $6,000 I have. 6,000, I'm looking for 7. 6,000, now 7. 6,000 will take this. It's July 21st, nice summer day. You'll have the whole run of the place. You can sunbathe, do whatever you want. Close the blinds. Do whatever you want. How many people can say that? You've heard of the Mile High Club? This would be the 22-person suite club. Not telling you how to live, just making suggestions. All right, $6,000 I have. 6,000 I have. 6,000, now 7. No, 6. 6 is going once. 6 is going twice. I am selling this for $6,000, sold to that fine gentleman over there. How are we on time? Can we do the one? No? Okay. All right. Can we do it? All right. I got a quick one. I'll throw this in. And believe me, you won't hurt my feelings. But I have been authorized to offer you 10 tickets to a show of mine at Giggles, which I referenced earlier. And it's not the Beacon Hill Bistro, but we will throw in pizza and soft drinks for everybody. For 10 people, if anybody wants to come to a show that I am headlining up at Giggles in Saugus, Massachusetts, you need to know 2 things. How to get to Saugus. Right?
Yeah.
No, that's really the only thing you got to know. That's really it. I thought it was going to get more complicated than that. But all you got to do is find Giggles on a night that I'm there, and we'll arrange it, and you can take 10 friends. And I'm not even going to just anything. Buck. Anybody want to do it for a buck?
I'm in. Tony, I'm in.
What's that? $500 I have.
There you go.
There you go, $500. 6. What's that, 1,000? I have 1. Ha-ha! To your 5. Ha-ha, sir, I say. $1,000. Anybody else want to make a bid? Anybody else? 1,000. Wow, I've never made that in my life. That's fair. Anybody want to go 1,200? 1,200 will take it. 10 people. Get you good seats. Pizza's fantastic. All right, we'll take $1,000 because that turns into 2, right?
Yeah, that turns into 2.
All right, great. Great, I'll see you there. 1,000. Once, twice, sold for $1,000. Nice. We'll figure that out and we're good. And you know what, ma'am? You get to see the dirty act. I'm not that dirty anyway, but you can park right in the club. It's like drive-in comedy. You just pull in, we put a little speaker in your window. It's like the old days. And then my voice just comes at you, and you won't sleep for 3 weeks. That's just the way it goes. Great, thank you very much. We'll work that out, and that'll be great. All right, thanks very much. I'm going to give it back to you,
well
Anthony.
Done,
thank
buddy.
you.
Nicely done. Great job. Great job. So that was $42,000, doubled to $84,000. Thank you all so much. And that's just from the auction. Everything on your table will be doubled as well, up to $100,000. It's tremendous. So thank you for your generosity. It's time now for our second award tonight. It's the Dr. Jim O'Connell Award. It's named, of course, for our founding physician and current president of BHCHP. And tonight we have two past recipients who are in the room, Dr. Carrie Akins and Dr. Troy Brennan. Give them a round of applause, please. The award is given every year to a member of the community who embodies the spirit of BHCHP by contributing to the well-being of society's most vulnerable citizens, which obviously is what this program does. To present the award, please welcome to the stage the one, the only, Dr. Jim O'Connell.
So thank you very much, everyone, and we're almost to the end. But a huge thank you to all of you for being here. And Barry did all the thank yous really well. And I just wanted to be sure, I was noticing that Representative Jeff Sanchez is over here, and I just wanted to say hello to him and thank you for being here, who's been so supportive. But it is my real honor and privilege, and I have to admit to you that I don't like having an award named after me. It makes me feel both dead and something else, but and embarrassed. But okay, but this is particularly special for me to give this honor for all of us to give this honor to Governor Baker. And I wrote a little thing in the program so that you could read that, because I only have been given 2 or 3 minutes to say what would take probably hours to say. But he has been a true friend of ours for so many years. And you may know that when we were in our infancy, we were trying to figure out how to put all this together, how to sustain it. And it wasn't clear back then, especially for those of us who had been doctors working on the streets and in the shelters, but we had no clue. We didn't even have a finance department. And I can remember when we were in real trouble, we went to the governor when he was then running EOHHS, and we were desperate to just sit down and talk to him about what we could do. And he gave us, as you may know, the day after Thanksgiving, which is kind of a quiet day when everybody's not around, he said, come on over, and spent then I think it was 3 hours we spent talking to him about what we were doing, what we were trying to do. And he thought about it as only Charlie can do. And I learned that morning how particularly special he is about, one, he's a very quick study, probably the quickest study I've ever run into. And two, Charlie thinks about solutions and how we can bring people together and come up with a solution to a problem. And he's fiscally very responsible about that. And when we looked at, just to share with you, our biggest problem then was an unintended consequence of big changes in the health system. And I'll give you an example that I often mention. When I was a senior resident at Mass General, and I think Dr. Akins is still here, the average length of stay when you were having open heart surgery would be about 5 or 6 weeks. If you had heart failure, the average length of stay in the hospital was about 3 weeks. If you had cancer and needed chemotherapy, we always admitted you for at least a week every month for your infusions. And surgeries like a hernia surgery, you'd be in the hospital for at least a week. If you had your gallbladder taken out, you'd be there for about 10 days. And what happened as we really improved the healthcare system and moved much of the care from inside the hospital to the home, homeless people, I think inadvertently, got left out. And if ever there was a real quiet injustice in the system, it was when you were discharged from the hospital but had to go to a shelter. You were left, or to the streets, you were left just with no place to recover, and think about it. So you've been diagnosed with cancer, which is already overwhelming for any of us. But when you've lost everything, have no one around, and then you're discharged to the streets to get your chemotherapy as an outpatient or your radiation, it's really difficult. And we were trying to figure out, how do you care for that group of people? And our medical respite program, which you've heard about, which we call the Barbara McGinnis House, was the idea of many of the homeless people and the homeless advocates, many of whom are still sitting in this room, of what we should do in response to that. But we had no idea how to do it. Went to Charlie, who thought about it. He called the Mass Hospital Association together. And I have to say, at this point in our lives, I hope you realize that, you know, we depend entirely on our community of shelters in the streets, but our program would never work unless we were able to stay very much a part of Boston Medical Center and Kate Walsh, I hope, is still here, and with Mass General, when Peter Slavin, who's my old residency mate, without the help of those hospitals, we could never take care of this very sick population. But the question was, what do we do when they move out of the hospital and back into the community? And our medical respite program came out of that. And the funding to this day, which is very complicated, was created for and sustained and thought through by Charlie bringing everybody together. And I remember very distinctly, it was not a Republican or a Democrat thing, it was a solution to a real problem. And then I've just watched over the years, and Charlie has always been that person. By the way, every day after Thanksgiving, from the many years after that while he was still in office, he left that morning open so we could come in and chat about and brainstorm about what are the problems going on with healthcare for homeless people and what are the obstacles. We were lucky to run into him, and as you all know now, we are incredibly blessed to have him as our governor. I don't need to repeat all that I wrote about, but I could tell you more and more about how really important he has been to him, to us. And then now he's assembled this incredible group of people, from Mary Lou Sudders at EOHHS, and we love to mention Monica Burrell, the Commissioner of Public Health, who is our old Chief Medical Officer. But with that group of people, along with a whole bunch of others, the response we have had to almost every issue that has come up with homelessness from a healthcare perspective has been creative, bold, and really, really wonderfully collaboratively done. And so I want to just say it's really my honor, and Charlie, I could go on, and I will forgive me for this, but it's my honor to present this award to Charlie. I wish it wasn't in my name, but I hope you could take that it's in my name as a suitable honor. We are incredibly grateful to you and incredibly proud to be your citizens here. Okay. And Barry, could you come on? We did miss a couple of cues. I'm very sorry.
Well, Charlie, this is yours. Let me give you this. You guys want to take a picture? Oh, sure. Let's take a picture. Okay. A little closer. Thank you. It's getting late, huh? It's Monday night. I only got about 45 minutes here, so we should be out by 10. I knew I was going to be the last on the agenda, and it's hard for me to even put into words what I think about Jim O'Connell and what I think about Barry and the rest of the gang and Linda and Cheryl and so many others at Boston Healthcare for the Homeless. So I really had to think a little bit about what I might say that would do justice to this. And by the way, Joanne, I got to tell you, I would love at some point in my life later on to have a job where I'm not accountable for my own insanity. Because I sure feel like that's what happens a lot of times in this job I have now. And to Peter and to Kate Walsh and the gang at Mass General and Boston Medical, you've been there for these guys from the beginning, and you were there for all the right reasons, and you stayed. And I know how much it's meant to them to have partners like that in the city of Boston to work with. And to John and Ann, thank you very much for bringing the heavy shoes associated with those very big footprints of your organizations to this organization year after year after year. It makes an enormous difference, not just the fact that you support it and your organizations support it, but you have big networks, and your willingness to lean on those networks to support an organization like this is incredibly valuable and hugely appreciated. And I'm sure will generate repeat visits year after year after year. So thank you. And I remember when Bruce Bullen, who isn't here tonight, which just totally bums me out, since he was my partner in crime in so many things. I remember when Steve Kadish and Mary Lou and I were trying to find a commissioner for the Department of Public Health, and Bruce was the one who said to us, "You should talk to Monica Burrell at Boston Healthcare for the Homeless." And that was like sold. I mean, it was, I suppose we have to interview her, but when somebody comes from this organization, they bring, first of all, there's just no group that I can think of in the healthcare space that's more creative and gets more mileage with less than Boston Healthcare for the Homeless. And they know epidemiology as well as anyone. So you were completely, we made you interview Monica, and I know it seemed like you might not get the job, but believe me, from the second we first started talking to you, the show was over, and we were actually trying to sell you on coming to take it. And Dan Tsai, who knew you cut hair, in addition to all the other wonderful things that you are capable of. And I would not be here, and I would not have had the kind of life and the kind of career I've had if it hadn't been for the fact that I really married up to Lauren Schott Baker, who was willing to put up with all of my bizarre behavior over the course of the past 29 years. Now, I thought really hard about what I would say tonight, and I decided that the best thing I could do would be to put in front of all of you, many of whom will know a number of these folks, but for those of you who don't, some of the stories from the shadows in Jim's book. Now, I've read that book a couple of times, and it's dog-eared, and I pulled it out last night, and here are some just sort of random thoughts from a walk, yet another walk through that book. And the first one is the chapter on Barbara McGinnis, because Barbara is, of course, the one who the McGinnis House was named after. And until I read this book, I just met her once or twice, but didn't really know that much about her. And she just had a wonderful way of framing what this organization was all about. And this is, most of what you're going to hear from here on in is going to be sort of an occasional thought from me, but mostly just references to the book, which if you haven't read, I urge you to do so, because among other things, it creates life and stories and individuality out of all of these people that are served. So this is Barbara McGinnis. I make no plans. I have no dream of a different society. I never think about that. I am busy surviving, like the guests. I am intuitive. We are overwhelmed. We offer care and relieve suffering, never judge. We are not in the business of changing people. Our purpose is to gently offer hope and options. Now that kind of pretty much says it all. But this book is just full of one story after another that builds on that theme. There's Bob Grauer, USMC, Vietnam War veteran, got a terrible head injury when he was fighting in the Vietnam War, and he put on a Stetson hat, basically to hold, when he was at the medical facility, to basically hold all the bandages around his head together. And then that Stetson hat became kind of his identification card for most of the rest of his life. And Bob could throw F-bombs around with the best of them, and was absolutely convinced most of the time that he was right and the military was wrong. And needless to say, that didn't really play very well with a lot of the folks in the military. But he was one of a number of veterans whose stories are told so brilliantly by Jim throughout the course of this book. And there's Jeremiah Noonan, who was a World War II vet, He worked as a laborer in a potato field, and then as a maintenance worker at Harvard. This is over the course of like 50 years. And as a graveyard shift janitor at Jordan Marsh. He lived in a rooming house in Everett for 30 years, and as he said, it was nothing fancy, just 4 walls, a bureau, a cot, and a bathroom down the hall, because I don't need much. Now, one of the things that happened to Jeremiah was the success of the greater Boston economy, which meant that eventually the people that owned the building that he lived in sold it. And when they sold that building, his rooming house, as well as sort of the most stable thing he had in his life, was lost. And Jim talks in the book about the first time he met Jeremiah, who closed the door behind him and then went into this long pitch about all his pains, which I think were just a function of 50 years of manual labor and probably not taking very good care of himself. But he was convinced that those pains were the result of things that other people were doing to him. And Jim talks about the fact that while Jeremiah had appeared to have had a pretty okay life up until the time he lost his place to live, that paranoia that was with him all the time, that was creating kind of his own personal hell on earth, as he would tell these fevered stories about people who were trying to hurt him when in fact what was really going on is his hips were given out from him and he had terrible pain everywhere he went. But he didn't think of it as a medical condition. He thought somebody was picking on him. And Jim talked about the fact that Jeremiah was inconsolable and in many times unreachable. And then there was Matthew Diamond, the steelworker and heroin addict, whose best friend was Daniel Parnell, who was a teetotaler. And how the two of them found each other is traced over the course of a few pages in the book. And it all wraps up in something called a Zagnet bar, which you have to read the book if you really want to see it for what it's all about. But in the end, when Matthew passed away, Daniel was holding his hand. And in some respects, it spoke to the fact that even here, there is just profound love and decency and warmth through the sharing of these life experiences that so many of these people have had. And then there's my favorite story, which is the one about Anne-Marie, who one day when she got dragged onto the bus, probably didn't want to be there. Dr. Jim was driving it, and he looked at her and he said, "Dr. O'Connell, you're in charge of the detox and I'm sick. Call now and arrange a bed. Be sure that Janet is the nurse on duty tonight. I had a drink about 15 minutes ago and I'll need Librium in less than an hour." She apparently was in charge, large and in charge always. But this book, which in my view is sort of a microcosm of the past 30 years, has so many stories, so many lives that just come out of the pages as you read it. And they're not generic terminology anymore. They're real people with histories and personalities. And these folks who are with them, not just day after day or month after month, but year over year over year over year, they know them and they know they are loved. And it's profoundly compelling. And it creates a sense of intimacy and personality about these people that I think we sometimes forget. And there's a point in there where Jim, after a particularly difficult outcome with one of his patients, he says, "Do our efforts make a difference, or is this litany of suffering and death inexorable?" Well, the answer, of course, to that is yes. Of course it makes a difference. Over and over and over again, it makes a difference, and it's made a difference for 30 years. For people dealing with profound isolation, there is friendship and family and companionship. And for people who are dealing with just enormous fear and anxiety and trauma and troubles we can't even imagine, there's a place for hope and dignity. And for people who feel this big, who feel as if the world is just bearing down on them in their own insignificance, there's this organization that treats them like they're the most important person in the world and tells them, as Jack said earlier, that they can be somebody. And I'll give you two others who speak to this. Ellen Daly and Dr. Stefan Cortez, and I apologize if I mispronounced his name. Now, Ellen Daly was a customer, a patient, a client at Boston Healthcare for the Homeless. And there was something that was just not quite right with her, physically. She had these terrible fainting spells. Nobody could figure it out. And Stefan was like a resident at Harvard Medical School, Boston Medical School, BU maybe, I can't remember. But he noticed that when Helen lifted her arms up like this, her heart rate collapsed. And he said that was where it was coming from. So he figured out that she had a goiter on her thyroid. So they removed the thyroid, and all of a sudden, she came back to life. And she became one of the original members of the Consumer Advisory Board. She was one of the leaders in the creation of the National Consumer Advisory Board for Healthcare for the Homeless. And she was vice chair of the board of Boston Healthcare for the Homeless for years before she passed away. And Stefan, well, he went on to become one of the country's leading authorities on healthcare for the homeless as a professor of medicine at the University of Alabama at Birmingham. The book also talks a lot about those moments when it just feels above and beyond. Those moments that I would describe as sort of the exasperated Jim trying to explain how complicated and difficult and challenging this work can be. But there's no question that that book is about the people who have been served by Boston Healthcare for the Homeless. That's who the book's about. And it's clear that Jim, for all those 30 years, as much as he was exasperated by the system, the laws, the healthcare system, the financing, and all the other stuff, he was enthralled by the people that he had the honor and the opportunity to serve year after year after year. And I just can't tell you how incredibly blessed I feel that I would even be worthy of an award named after Jim O'Connell. Because, you know, we talk all the time about angels among us. Very few of us ever get to meet one. And in Jim O'Connell and the folks at Boston Healthcare for the Homeless, we have angels among us. Thank you very much.
That was fantastic. Really good. Thank you, Governor. Congratulations to our award winners, the Governor and David. John and Ann, thank you so much for your contributions in co-chairing the event. To Barry, to Jim, to Tony V, to everybody who made this night special. Preliminary estimates are we raised over $130,000 tonight. Yeah, it's great. It's great. Thank you all for being here. Thank you for staying a little late. And come visit at some point. We love you all. Thanks so much. Have a nice night.
I say